Good evening, everybody. My name is Theo Williams, and I just want to welcome everybody to the Green Stream, where the revolution will be televised, not televised, but live streamed. And this is where we're all about peace, ecology, democracy, and social justice. Today, I have a very special guest for everybody to be joined with, and her name is Ursula Rozum. She has been active with the Green Party since 2010. She's managed several competitive Green campaigns, and in 2012, she was a candidate for Congress in upstate New York. Currently, Ursula works with the upstate campaign coordinator with the Campaign for New York Health. She's also secretary for the Green Party of New York and a national committee delegate for the Young Greens. Ursula, welcome to the Green Stream, where the revolution will be live streamed. How are you doing today?
I'm great. I'm really excited to be talking with you and all our Green Party comrades around the country and maybe around the world.
That's right. Absolutely. Now, if you wouldn't mind, I gave a little bit of a bio for you, but if you wouldn't mind just extrapolating a little more about yourself and why you are so into what we're going to be speaking about today, single-payer healthcare.
Yeah, thanks. I'm really excited to be here talking with you about the fight for universal healthcare. Healthcare is just one of those issues that impacts everyone at some point in their lives. Myself, my family came to the U.S. from Poland. They were activists with the anti-communist solidarity movement in the 80s. And they basically came to the United States just because they wanted to be able to work hard, earn a decent living, and have a nice life. Kind of like the classic American dream. And then, really quickly they realized that in the U.S., that's not that simple. Just because you work hard doesn't mean that you're going to be able to meet your basic human needs. And so growing up, my parents, they split up when I was young and I lived with my mom. She worked in a car dealership, and thankfully her job offered health insurance. And there was this joke we had growing up with my Polish friends that Polish people don't go to the doctor. And at first I really thought it was just like a Polish thing. Polish people don't go to the doctor. And then as I got a little bit older, I realized that it's not because we don't believe in medicine. It's because the U.S. healthcare system is so complicated. And just because you have health insurance doesn't mean that you yourself can't afford to get healthcare and access the healthcare that you need. So personally, I'm 33 right now, and I went through most of my 20s without any health insurance, uninsured, relying on places like Planned Parenthood for preventative health care and reproductive health care. And then recently I got married, primarily because my partner of 8 years has a job with New York State that has great benefits. So we kind of made a media spectacle of it, got a story in the paper about this couple getting married for healthcare access. So access to healthcare and the inequities in healthcare access are something that I've just been keenly aware of all of my life. And so here in New York State, we have a campaign to pass a state-based single-payer healthcare bill. But really, the Green Party's position on healthcare in support of a universal single-payer healthcare program is really the reason why I registered in the Green Party when I was 18 years old. Basically because the Green Party was the only party that was out there talking about healthcare. I remember my dad supported Ralph Nader, and that was what he told me, that Nader supports universal healthcare and is opposed to U.S. military, U.S. wars overseas. And so those were the two issues that really actually got me in the Green Party, was peace and the healthcare as a human right.
Well, absolutely. That's one of the things that the Greens stand for, and that's that everybody should be treated as a person. And just because you make a certain amount of money, you shouldn't be treated better than anybody else. So that is absolutely one of the reasons why you should be a Green. That's phenomenal. Now, I was just curious, for those who aren't really familiar with what single payer is, would you try to describe it to anybody that's listening that might be a novice or may have heard the term but really isn't too sure about? Because I noticed you said I've noticed that you said universal health care a couple of times, but I know single payer healthcare, single payer and universal health care a lot of times are one and the same or misconstrued, or just clear that up.
Yeah, well, the first thing I'll say is that to be part of the fight and to really believe in the idea that healthcare is a human right and that it's something that we should fight for, I think it's really important to just make sure that no one thinks they should be a policy expert. No one should need to be, a doctor or an economist to feel like they have a legitimate voice on the issue. But in terms of the definitions of single payer, there's lots of different ways to set up a healthcare system. You could have a completely socialized healthcare system like they do in Cuba, where everything is run by the government and all healthcare workers are government employees. But when we talk about single payer, what we're talking about who pays the bill. And so when we talk about a single payer healthcare system, we're just talking about getting rid of the for-profit insurance companies and the really complicated web of public and private funding that goes to pay for healthcare and replacing it with a single funding stream. So, for example, I'm most familiar with the New York Health Act, basically that we would have everyone pays into a pool of funds through our taxes based on our ability to pay. And then it's the government, whether it's the federal government, if we're talking about national universal health care, like what's proposed, there's a national bill called the Improved and Expanded Medicare for All Bill, HR 676. So basically that would set up a structure where you have a Medicare-like entity reimbursing doctors and hospitals. And we all pay into it basically based on our ability to pay, based on our income. And that way, when you get sick and you have to go to the doctor, or if you have to fill a prescription, you don't have to pay out of pocket. And there's, I would say if people should look up a study by the Rand Corporation that looks at how copays and out-of-pocket costs prevent people from going to get the health care they need. And it's kind of like a psychological thing, right? If you think you're going to have to pay, you don't know how much you're going to pay, you don't think your ailment is life-threatening, or maybe it is, but you just can't afford to pay out of pocket. The current system really creates a lot of barriers to people accessing care. So that was kind of a long description of what we mean by single payer, but it basically just means who pays the bill.
Now, I would be remiss if I didn't ask. Now, when you were talking about, being based off of somebody having to pay, or everybody paying based off of what they can pay, is this something that's going to be kind of taken out of every paycheck, kind of how we do with Medicare, Medicaid right now, or is this going to be something, every April where you go to pay your taxes, it comes out during then?
I think that it would depend on the kind of work you do. For example, if you are a self-employed person that files taxes on your own at the end of the year, and you just pay once a year, then you would pay based on your income when you pay your taxes. But if you are, like many people, employed by somebody else, yeah, it would just be a payroll deduction that you don't really even see. I went to school in Canada for college, and even folks there that are like pretty conservative love their healthcare system because it's just so much simpler and they're able to go get the healthcare they need. And one of the biggest arguments people have, conservatives will throw against universal healthcare or single payer healthcare, is that this is something that's going to raise our taxes. Well, yeah, we're not talking about free healthcare. We're talking about healthcare that's paid for based on our ability to pay, paid for fairly out of our taxes. And when you get sick, you don't have to worry about the bills. So yeah, it would be very similar to how we fund Medicare or Social Security through payroll deductions.
Now, it's funny that you hit on the fact that the conservatives, a lot of times, one of the first things that they tell people to try to scare them away from universal health care or any form of universal health care is that it's going to cost you more. One way or another, it's going to cost you more. I was looking at a 2016 Kaiser poll where 64% of Americans, they had a positive reaction to the term Medicare for all, but only 44% polled had the same reaction to the term single payer. Now, do you see any particular reason as to why it's received that way? And if so, is there any way that we can have this term received better?
I think it's really important to take into account the words that we use when we're trying to communicate with people. And that's why I always urge activists and organizers to lead with language that we think people will understand. There's been decades of propaganda against single payer, but when people are familiar with Medicare, it's a program that most people like, if not love, even though in New York, for example, seniors that are on Medicare still have on average about $6,000 in out-of-pocket costs. So when we're talking about Medicare for all, it's really important to, we're not just talking about Medicare as it is for all, but rather improved and expanded Medicare for all so that there are no more out-of-pocket costs when we go access our healthcare. When I talk to people about healthcare, actually the way I start the conversation is to ask about their experiences accessing care. So we use a really powerful outreach tool in New York that we adapted from what's called the National Healthcare as a Human Right Collaborative. And it's a survey tool basically that guides a conversation with a healthcare activist and a member of the public and asks really basic questions. Do you have health insurance? At any time in your life, have you or someone in your family struggled to pay a medical bill? Have you or anyone in your family ever put off accessing care due to concerns with costs? And so the way that I encourage folks that I work with to approach organizing is first by asking questions and listening to people's experiences. And after that first step, then sharing with them that in New York or, nationally, we have a solution. I'm sorry, I keep slipping into New York because that's what I'm most familiar with. But I think that tool of asking people questions about their challenges is a really good way to get people to open up. I think back in the day, they used to call that like consciousness raising, and like organizers decades ago would have consciousness raising sessions to get, talk about their personal experiences. And so, the phrase that polls really well, I find, is guaranteed health care. To start the conversation, I always use phrases that I think people will respond to positively, and then talk about single payer when we come to, well, how's it going to work? How's it going to function? And I find that folks that I would describe as working class, for example, whether it's white working class, people of color, tend to be much less skeptical of the idea. It's when I start talking to folks that have had much more privilege in their lives